Welcome to the Friday Focus. My name is Dr. O from E&S Orthodontics, and it is approximately 1 month since I got my braces put on. And it has been a wonderful month because I get to have no empathy for my patients going through treatment. I'm just joking. I have a lot of empathy for you all, but I just wanted to let you know that it has been 1 month. I've survived, and this week's Friday Focus is going to be talking about Phase 1 and Phase 2 treatment. And I know that we have talked about this in the past, but a couple questions came up in what is Phase 1 treatment? And Phase 1 treatment is when an orthodontist, i.e. me, or Dr. Saavedra, feel that your child, who at an early age, maybe before they have all their adult teeth in, maybe at the age of 7 or 8, actually come in for an orthodontic evaluation, and we actually start treatment because we've diagnosed something that requires immediate attention, or we need to create space or correct a crossbite. So there are multiple reasons why we might start early treatment, or what we call Phase 1 treatment. And so I know a lot of parents, it might not be in their view to bring their children in at that young of an age, but one of the things that we're really out to do is we're trying to mitigate risk as we proceed in your child's orthodontic care. And what that means is that we know that if we do things a little early, or if we time them in a correct manner, there are some problems that we can avoid later on in life. And one of those things that we're always talking about in the office is mitigating the risk of mitigating the need to have adult teeth taken out in order to create space for all your teeth. And so what we do is we start to develop space for all the teeth early on, and that's why we do Phase 1 treatment. Normally what happens is parents will always ask the secondary question is, if I do Phase 1 treatment, do I have to do what they call Phase 2 treatment? And Phase 2 treatment always follows Phase 1. And so 99% of the time, if you do Phase 1, we do Phase 2. And Phase 2 is really when all the adult teeth are in, usually at the age of 11, 11 and a half, 12, maybe sometimes even as 13. And at that particular point, our concern or our focus is actually trying to get the bite correct. We actually want to get the teeth, and since all the adult teeth will be in at that point, that's where we make sure that the overbite's corrected, or that's where we make sure that the back teeth are in the right alignment. And so that's what we consider Phase 2 treatment. And so that is in contrast to what we call comprehensive care, which is where you don't do Phase 1 and you just go straight into full braces. And so I hope that starts to distinguish between what Phase 1 and Phase 2 is, and a little bit, I'm not really going to elaborate on comprehensive treatment, but just understand that when we engage in Phase 1 treatment, we are out to make a difference in your child's mouth in terms of creating enough space for it, and we're really trying to create a better outcome. And there's some doctors who will say, well, you don't really need to do Phase 1 treatment. And we know that when we start to look at adult treatment or adult patients who come into our practice, and you got to understand, a lot of our patients in our practice, about 30, I think it's like almost like 35% of our practice is made of adults. If you see their problems, and then you sort of like take a step back and say, okay, how can we avoid that for them? Or how do we avoid that with the kids that we have in the practice? Then it only makes sense that we do Phase 1 treatment. Well, listen, if you have a child who hasn't seen us for an orthodontic screening and they're 7, 8, or 9 years old, please bring them in. Our exams are complimentary, as we always do, but it's really important for you to get that education on whether your child needs it or doesn't need it. And so hopefully you'll give us the opportunity to share our knowledge with you and give you our expertise on why we do Phase 1 and Phase 2. Now, let's put that aside and let's talk about something that's really exciting. October 14th is right around the corner, and that's next week. And we have our Fall Festival. It's our 6th annual Fall Festival. We have a Disney theme, and it is absolutely crazy this year. We have close to 1,000 people who've already registered for the thing. We're going to be closing it off at 1,100. And I just wanted to make a note because I just want to make sure that you know that in order to win the free braces, I know that you're registering online, but you also have to attend the event. And I want to make sure that you realize, like, in order to win the prizes, you have to be at the event. And so if you need to clear your plans for the week or make arrangements so that you're there, remember 5:30 to 8 on October 14th at our Peoria office location in the parking lot. So if you've registered, please make sure you show up, because I would hate to do what we did last year. And last year we had a couple people who weren't at the event and they didn't get to win the free braces. And so I think one person lost out on free braces and one person lost out on one of the great gifts that we gave. So we're looking forward to having a great week. We're looking forward to having a great next fall festival. Haven't decided what I'm going to be in costume. If you haven't, make sure you decide what you want to be. Come in costume. Enjoy the night. It's a fun night. We have a lot of games scheduled, a lot of food. We'll see you next week at the Friday Focus, and we'll see you next week at. We'll probably have to do we won't be able to do the Friday Focus next week because we're going to be at the Fall Festival, unless we do it live. That would be great. But enjoy, have a great weekend, and we will see you next week.